Welcome back, and we are so glad to welcome our next speaker, Dr. Myroslava Drohomyretska. Dr. Myroslava is a very dear person for us. First of all, because she's an IFUNA member with us. So with my dad, that, as I told you, was one of the founding members of the IFUNA at the very beginning in the early 2000s. With Dr. Gabor Herman, that was speaking earlier today, and also with myself, because I have to say that I am so glad that I was joining the board of the IFUNA, the International Functional Association. Dr. Myroslava will speak to us about a very important subject. Why do some children breathe with their mouth? Myroslava is an international speaker, a wonderful speaker, but not only, she's also the president of the Association of Ukrainian Orthodontists. And of course, we are having such a big fault for her. She couldn't do the lecture in live for obvious reasons, but we were recording the lecture with her a couple of days ago. It was very important for us that we maintain her lecture because we knew how much she had important stuff to tell us and to tell to all of you. It is so amazing from her that she was able to find the time to prepare this lecture for us and to record it with us. We are so glad to be able to show you the record of the lecture of Myroslava. Thank you, Myroslava.
A lecture on the topic why did some children breathe through their mouth? Well, first of all, I would like to introduce myself. I'm from Kiev. I was born in Kiev, and I have a private clinic in Lviv and in Kiev, and I am the head of a department in Kiev, and have lots of students in Ukraine and outside of the country, which I'm very proud of. And today we would like to present our vision about this problem, which is quite common amongst children. How the person should breathe only through the nose, because breathing is as natural as process of walking, and you do it unconsciously. Breathing is unconscious, and the work of your brain, of your muscles, of the nervous system, and even the uh, face dynamics depends on this. We want to say that each organ of our body is devoted to something. It has a certain role or a certain function, and if we are breathing through our mouth, it's like eating through the nose. But unfortunately, a lot of children worldwide are breathing through their mouths. And in the literature, there are lots of reasons why children are breathing through the mouth. But do we ask why? Why today we have so many kids who have this habit or reflex with mouth breathing, which was preformed, and we allowed ourselves to use a systematic approach to um, rearrange the factors and to see the factors which lead to this mouth breathing, as well as factors which form mouth breathing. The factors which cause mouth breathing, they can be divided into two um, parts. First of all, the fetal factors, the neurosomatics during the pregnancy, emotions of the mother, stress, physical and chemical factors when the child is still in the fetal phase, which influence mother's body. And in future, they may lead to predisposition to mouth breathing, but factors which cause mouth breathing, they are based on anatomophysiological features in every age group and age period, because respiratory organs of different ages, they have their structural and functional and physiological features. Understanding of these anatomical and physiological features of respiratory organs in children is very important, because anatomy, it leads to a certain structure during this or the other period of development of a fetal and of a kid. And we try to systematize orofacial dysfunctions in different age periods based on physiological and pathological aspects. The first stage uh, is the newborn period. Very often during this period, a child is sleeping with an open mouth. And a newly born kid, physiologically, they are breathing through their nose, and they cannot survive the nasal um, if they have nasal restriction. And a proper development of craniofacial area is due to breastfeeding and the ability to breathe through the nose. During this period, it is important to utilize this anatomical and physiological feature of a child. Why a newborn child is sleeping with an open mouth? Because the um, mucosa discharges a certain secret when the breathing is constructed, and besides, they have additional charge of histamine, which have the swallowing of nose, and they have restriction of the airways, and the kid opens the mouth, and definitely part of the air is through the mouth. A newly born kid has this. He pulls out a tongue. Again, uh, subconsciously, the pattern of tongue position is formed till the age of 2 years. So the kids, they simply don't know what to do with the tongue, because they're just learning how to use and how to position a tongue between the lips to follow. The next period is primary dentition period. During this period, what we have to know, uh, ENT doctors from 3 to 7, they are seeing that the lymphoid tissue is growing.
And during this period, an adenoid inflammation sometimes appears, which leads to nose breathing problems and automatically means that a kid is prone to mouth breathing. Pediatricians also note that kids at the age of 4 to 8 has rather weak muscles at the oral cavity, which can lead to open lips because proprioception is not working yet and automatically lips separate. Proprioception during milk teeth leads to a special reaction to occlusal contacts, especially the lack of this reaction. I mean that the kid is prone to opening the mouth, and it is physiologically normal to open the mouth, and they do not know that closed teeth and closed lips is what they need physiologically. Mixed dentition is the next period we face, and this is the moment when functional occlusion is built. This is the moment from 6 to 9, which is highly important for the whole system development in the whole body. And we know that this is the exact period when the most severe deformations in the orofacial area start. We know that a kid under 9 having physical activity increases breathing 3-4 times. But to compensate to that, the brain does not get enough oxygen. So the processes which are very common and very comfortable for the adult body happen at the age of 6 to 9. We know there are several specific features of neuromuscular transmission in children. Efferent and efferent impulses tend to form from 8 to 10, and neurosynapses are mostly formed by 9 years. This all influences that the development of a pattern is established at this very time. And even after we perform adenectomy, the habit to keep the mouth open still stays in place. We have spoken about the factors which are influencing the mouth breathing. But now I'm gonna say a few words about the factors that form the mouth breathing habit. And here I need to say that those are somatic dysfunctions of cranial structures, muscular facial factors, neurological factors, and humoral factors. And I will try to explain all of them. Somatic dysfunctions of cranial structures. What do they mean by that? It could be the compression of sphenobasatal osteochondrosis, it could be the rotation of the cranium, it could be the compression of other cranial structures. And this is the crucial moment to understand that this trauma has started at birth. We know that during birth, some trauma could happen during childbirth, and this trauma will lead to further deformations and further compression of certain cranial structures. Neck injury is rather frequent according to literature. It has 35% of incidence. We know that a tongue is connected with epiglottis and all the muscles which help move the tongue. They are also connected with the neck, with the epiglottis, and this is why the kid would be open at the childbirth, and the kid will stay like that for a longer time. Other type of trauma like birth stimulation, fast birth, or even emergency C-section could lead to the fact that the kid is immediately transferred from a high pressure environment to a low pressure environment. And this is the moment when her bones are not able to elongate, and the kid gets a barotrauma, and the kid tries to compensate it to change the pressure inside his body, inside his cranium, and outside. We also know that cranial structure, especially sphenobasilar synchondrosis, and we know that the bones of the cranium after the birth, they are still in the wrong position. They need to move after the birth. And if some of those bones stay in there in this wrong place, this will lead to certain compression and morphological pathology later on. This is why such kids will mostly have high intracranial pressure and compensate it with mouth breathing. This is why these kids automatically open mouths. This is how they save themselves. They cannot survive without it. Mostly they cannot even explain it, but they breathe through the mouth. This is the reflex which is needed on the first stages of life, and further on, it doesn't matter what myofunctional exercises kid would do. It doesn't matter what devices and appliances you will use. If the reason is high intracranial pressure, nothing would be successful. Next factor would be neurological. We have to note that innervation of the tongue and muscles, facial muscles, innervation comes from central nervous system, and if a certain nerve is damaged, especially the facial nerve or one of the bulbal nerves is damaged, it will cause the lack of tonus in labial muscles and in tongue, and this is the moment when our exercises would not be successful. Next factor is endocrinological or humoral, which could also lead to open mouth in kids, because the congenital defect of the thyroid gland has open mouth as one of its symptoms. And a certain position of a tongue, a low position of a tongue, is another one. And this humoral factor might lead to an open mouth. Next factor which I'd like to discuss with you is musculofacial factor. We know perfectly well that form defines function and function defines form. There is none without the other. And it is important that all the orofacial dysfunctions in children is the dysfunction of swallowing, chewing, breath, or speech, and they happen due to the lack of the balance between perioral, head, and neck muscles. Because breathing is one of the most important functions of a human being. The body would do whatever it needs to maintain the breathing function. That's why it's not surprising that function has its prioritizes the form, but due to the wrong form, due to the wrong morphology, the form itself would suffer at the end of the day too. According to the theory of functional metrics, the growth of the facial skeleton is a response to functional needs and is regulated by the soft tissues surrounding the jaws. In chronic oral respiration, children as a rule have an anterior position of a hand, and I'm pretty sure that several speakers today has shown these problems and have shown how our posture adapts to this problem. Mouth breathing mostly is and goes hand in hand with frontal position of the head, which prones the formation of a second-class occlusion. In kids with the wrong position of the tongue, the right position of the mandible would be undoubtedly changed due to balancing issues. And moreover, the craniovertebral angle is a value of high importance. We orthodontists use this angle as an index of cranial adaptation. When this angle is bigger, the angle between the McGregor plane and odontoid plane is bigger, it means that the cranium is rotated forward. When it's less, the cranium is rotated backwards. Of course, mandible anomalies would also lead to changes in breathing, could cause mouth breathing and postural troubles. I wouldn't go deeper in this subject since I'm sure it was or will be covered during today. But of course, I cannot avoid this, that occlusal anomalies would cause and would lead to postural changes. Both in upper and lower mandible, anomalies will change the posture in different ways, but they will, and a certain occlusal change might lead to postural balance. Like in this case, a kid has narrowed arches both on upper and lower arch. I tried to show a certain pyramid. You are surely acquainted with Maslow pyramid, and we tried to build a certain pyramid of functional and orthodontic health, where different occlusal factors, balances and posture take their place. And of course, at the very top of this pyramid, we find the word harmony, harmonious development of a human being, taking into account that all the systems in a human body are working as a tight system like a watch. We decided to found the dental body synergy system. This system helps to diagnose and treat craniofacial dysfunction. It helps to regulate neurohumoral factors. It uses the tricentric concept and the neuropostural principles. It uses the neuropostural principles as well. this integrated approach to solving the oral breathing problem, according to our dental body synergy concept, consists of 3 phases. First of all, it is the basis correction. We have to correct basic structures where endocrinologists, ENT specialists, osteopaths, who correct all the bigger major issues, osteochondrosis or endocrinological troubles should be solved. Only the next stage would be myofunctional therapy, and you could use whatever you want on this stage. Should it be exercises or myofunctional therapy or speech therapy, whatever you want. As a result, you will get the balance between muscles and fascia of the head and neck area. After we build this part, we go to the 3rd stage, which, by the way, might be combined together with 2nd stage, myofunctional therapy. The 3rd stage is orthodontics itself. Orthodontic treatment should always be performed together with myofunctional therapy. Orthodontics cannot be performed without myofunctional therapy. And using 3D equipment, we built the situation when a kid could further develop in a balanced way. With this short lecture, I tried to say that the problem of identifying the causes of oral respiration in children is a huge issue at the moment, not only for orthodontists and ENT specialists, but also for pediatric dentists, functional therapists, and so on. Knowledge of these features, knowing how the kid evolves, knowing how the airway develops, helps the specialist help the patient in a best way. And in case we detect any risk factors, we can organize rational treatment and adequate care to each and every patient, and also prevent any further complications. Taking into account that breathing is a very important, is a crucial system in our body, we have to know that it's either my way or the highway. It's either being sick or breathing with your nose. Since we mostly speak of treating kids, we know that kids are the sense of our life, and we are responsible for their lives and their treatment. I send you huge greetings from Ukraine, and at the moment it is very important for us that our kids would not only breathe normally, it is very important for us that they would just breathe and live at the very least. Thank you very much for your attention.
I wanted to especially thank Myroslava, that is unfortunately not able to connect in live with us, but that will be in the IFUNA Congress in Argentina in next September to present her latest work.